I have to say, I'm feeling a little bit of gratitude here to be able to speak to a largely Canadian audience. I know that there's folks from other countries as well, but it's something that, I think when we think of WASH and just in my experience working at WHO, sometimes the opportunities for Canadians are well, we can make more of them. So it's great to see all the practitioners, researchers, and others on board here. And thanks also for the opportunity. I also wanted to thank, there's a few people I've seen online, and I wanted to thank everyone because you will see that I have all my slides are appropriated from others. So there's been a lot of hard work being put into this presentation, but not necessarily by me. But what I'd like to do, and feel free again, to interrupt, we can make this informal, but to give people a little bit of a sense of where we meaning WHO, the international community, a little bit of a perspective from UN Water as well, see the status of WASH and also where we see our opportunities and priorities for change. So I think with that, if it's okay, I'll just break right into it. Although I guess I'm not sharing my screen, right? So thankfully I haven't started the progressing on the slideshow. Just need to figure out how to do that again. We went through this, didn't we? Share screen is looking slightly different. Oh, there it is. Okay, the green button. I was just saying I'm used to the Teams app, and now suddenly I know the Zoom was popular at one point, but it's become a little less user popular for me. Okay, so if I get a little thumbs up, if you can see the presentation, perfect, thank you. Okay. So I wanted just to really begin with, kind of trying to make a little sense of the WASH and health world. And it's an important thing because I feel like we're getting, a deluge of information, and there's a fair amount of consensus, I think, on where we need to go. But at the same time, when I think about how people perceive WASH, and I feel like there's like kind of three broad categories. There's the kind of WASH as a persistent, intractable problem, and one that really we just kind of have to maybe wait for economic development to solve. And that's a bit of the gloom and doom story. And there's of course a grain of truth in that. And we're seeing resurgence in cholera and not acceleration or even backsliding in certain countries. Then there's the second perspective is the WASH wasn't that solved long ago. It's an interesting thing, but it's a problem of the past. And the third is this whole, well, we have an opportunity like we've never had before. There's unprecedented political commitment. The international organizations and community have kind of rallied together around one cause, and there's cause for optimism. And I think, again, there's probably a little bit of a grain of truth in both. And so just what you see on your screen is a couple pieces. One is the SDG 6 synthesis report that was collectively put out by UN Water, which gives a little bit of a summary, kind of a high optic, or a kind of helicopter view summary. And then one was a statement put out by WHO and UNICEF, which I think is really quite a cogent statement indicating what we need to do and what our advice is. And that's something I'll return to. And then a little bit of an editorial, which I'll talk about. But at the end of the day, I think when I think about this a lot, I think, okay, well, the safely managed water and sanitation and basic hygiene, but hygiene, hand hygiene, as articulated in the SDGs is really health protective. Like that is actually a very good objective as it's defined and monitored. And then the method gets a little complex, and that's why we're all researching it. But it seems like the consensus is that we have to do comprehensive kind of progress looking at all aspects of governance all the way through policy, financing, implementation, and there's the kind of consensus around WASH system strengthening. So that's maybe my long-winded beginning. And I wish I was doing a presentation where I could tell you about a specific technology in the field, and we could talk about how the community is happy right afterwards, but there's a little bit of discredit to those ideas as well about project-based WASH and the sustainability. So what the UN SDG 6 progress report just kind of tries to compile is a lot of WHO, first of all, a lot of WHO and UNICEF monitoring, and I think many of you will be familiar with the joint monitoring program, and I know Clarissa is here and advises us on this, but this need to accelerate faster and faster, and I'll talk a little bit about these acceleration scenarios in the next slide. But as we get closer to 2030, of course, and progress, if progress, and we're not seeing and progress accelerate, then these kind of multiplication acceleration scenarios will just increase till they're won't really give us much room for maneuver. So right now we're seeing beyond WASH that water quality is suffering, and that's obviously impacting our drinking water quality that we're receiving, in households. And so there's obviously a big wastewater issue. We have new data talking about 42% of households not treating their waste properly. And of course, there's environmental impacts. Climate change, we'll talk more about, but there is observable rapid changes in surface water in 1/5 of river basins. So this is looking at imagery from above, including satellite imagery. And there's a whole issue about needing to kind of cooperate more together through integrated water resource management. And then basically radically improving financing. And we know that ODA is going down. So we've changed, on one hand, we've changed the goalpost to safely managed, which is appropriate, but makes it harder and harder to make progress because of the rigor of safely managed, and the ODA is frankly not meeting that standard. So we're in a position where we'll have to look at household expenditures themselves and government to fill the gap. And of course, there's more and more concern about inclusivity, gender, and being left behind, and making sure that there's participatory procedures in place. So that's the kind of overview. And I think hopefully most of us are familiar with these figures, which again are on one hand, not necessarily improving. And on the other hand, I'm going to be speaking a little bit about the health impacts of so many people being left behind on safely managed drinking water and sanitation and hand washing. And this is like the kind of health determinant piece that WHO is very concerned about. But before jumping into health, let's just take a look at these acceleration scenarios that I mentioned before. So if you haven't seen these graphs, I find them very instructive, but what it does is it looks at the annual rate of change, the actual linear regression line that JMP can establish through all of its monitoring of household surveys and administrative data, and then kind of project forward to 2030. And what we see on the left-hand side of the screen is safely managed drinking water currently at 69. And then if we continue with, we can say business as usual, we'll get to 77%. So in fact, we will need to kind of make that curve. If we did it in straight lines, we'd have to accelerate 6 times for drinking water. And then following the same logic, 5 times for sanitation and 3 times for basic hygiene. So the task is quite an immense one. But then let's pause for a moment and think about what this actually means for health. Now, I think most people think of diarrheal disease, and rightly so. The figures for diarrheal disease have been concerning for decades. But I mean, it's very interesting to think about health as according to WHO's definition, which is not merely a complete, not merely the absence of disease, but it's about well-being as well. And I think certainly a lot of folks working on sanitation, thinking about impacts around dignity and personal safety, school attendance. These are big issues that directly impact our health if we define it like that. And of course, like when we think about the issues around drinking water quality, and if you read the news in developed countries, you probably read about all those emerging risks time and time again, pharmaceuticals and drinking water, things that we can detect. PFAS dominates the news, microplastics, what will this do to us? And we also, at the same time, know that arsenic and fluoride, are the main issues of sort of longer term exposure to chemicals. But all the stuff on the left-hand side are the big drivers that we're trying to kind of deal with, and those are infectious disease risks. So the latest evidence that we have on this is it was published last year, and it's published simultaneously in the Lancet and a standalone WHO report. It was looking at 4 health outcomes. And you could see that there's 1.4 million deaths globally from WASH, which is a complete underestimate because we are only able to get enough information on diarrhea, acute respiratory infections, and then to a lesser extent, undernutrition and soil transmitted helminths. So that's the burden. But I think what's interesting and what I wanted to kind of get across today was also the need for more research, because I'm not going to kind of go down the big rabbit hole of the methods for getting at these estimates, but there's a number of kind of variables that they depend on. And one is, so for example, diarrhea. To get at the diarrheal disease estimate, we need to know the WASH service provision in the country. So where how many people have access at what level of the JMP ladder. And then the overall diarrheal disease envelope, which is disease data. And then the most complicated thing in many ways is looking at all the intervention studies and trying to kind of understand, what the contribution of WASH is to improved health. And many of these intervention studies don't really match what we would consider a counterfactual of really safely managed services. They're all a little bit like, kind of the data is limited and there's not many studies and they're not getting to that. So there's lots of research there to be had, but this is the best data that we have to date. And the thing I mentioned also about cholera, I find myself in cholera meetings on a weekly basis here. Because of this resurgence in cholera, we're seeing cholera outbreaks in countries that we've never seen before. That haven't had cholera in decades. We're discussing this with a lot of concern, and it comes back to the failure of the WASH system. But just to zoom in, for example, on Zimbabwe for a second, we're seeing, why is there cholera? Well, I mean, it's the usual WASH reasons. But it's also a waning of the effects of the oral cholera vaccine. There's a mobility of people in the festive season. There's many countries, as you can see around it, where cholera is being potentially transmitted through borders. So this is, I think, when we talk about everyone needs safely managed services, well, some people need basic services now, and we need to figure out, how to kind of target vaccination and WASH interventions in a way that makes sense so that these countries are not affected. And of course, it's climate change. It was when I was struggling there for thinking about the other cause. It is very much climate related as well. Okay, so that leads us to climate change. This was, I think, a lot of people in the WASH community are feeling reasonably good about themselves because we have now a global goal on adaptation, that the first objective is around promoting or establishing more climate resilient water and sanitation services, among other things, and getting hopefully more climate financing to support WASH. But at the end of the day, this is just another exacerbating factor that's going to make life a lot more difficult. 250,000 additional deaths per year, and 3.6 billion people living in areas that are already very susceptible. And then maybe just to look at something that maybe some of us haven't thought of, but what's interesting with climate change is this kind of proliferation of vector-borne diseases. I know some of my friends recently have gotten dengue fever, and I'm hearing more and more anecdotal reports of people getting dengue fever, and then also malaria, invasive malaria, which I'll talk about in a moment. But these are, this is related to climate, and there is a role for better management of wash in this. And for example, Paris for the first time was spraying because of vectors. So this is something that's coming back and could haunt us in a very deep way. But one thing that we need to do more, be aware of also, is this Anopheles stevensii, which is a malaria, invasive malaria mosquito, bringing malaria from India and Asia over to the Horn of Africa. And it acts in a way that is really kind of can only, or very much controlled by a wash response. So things like containerized drinking water, we need to essentially manage our water storage better. And that is often left out of the control programs. People thinking of obviously things like drainage and standing water are also a big deal in terms of making a difference. And although it may be somewhat unpalatable to people, considering larviciding, drinking water is also another option to try to get a handle on this. But there's a number of, this is spreading to urban centers in Africa, and to populations that don't have a sufficient immunological they're immunologically naive. Okay, so this is unlike in India. So this is something we need to look for, and we're working through a public health emergencies network to try to get better response from the emergency colleagues working on these things. So I'm going to now completely shift gears away from some of the health issues that I highlighted, and talk a little bit, but I think are the upstream drivers of poor wash progress and coverage. Then hopefully many of you are aware of the UN Water Global Analysis and Assessment of Sanitation and Drinking Water, or the GLASS. We never say the long form. And this year there was, I believe, something like 121 countries that were featured, so it's growing. And while some of the data is captured via, kind of a questionnaire and group discussion with stakeholders in countries, it does give I think, a reasonable kind of profile, I guess, of how countries are feeling about the wash situation as far as their systems and enabling environment. And so the one thing I wanted to zoom in here on is on this issue of coverage targets. Because what we often do is we think in the UN system, and maybe around the world, we all need to have 100% wash by 2030. But of course, countries have set their own targets, and those targets are not necessarily safely managed. They may be a combo, or they may basic and safely managed. And I'm sorry, I'm not giving you all the JMP definitions, but basically they may be a modest wash target, or they may be a very rigorous wash target that includes, treatment of waste or safe storage and household access to safe drinking water. But what was kind of interesting, and you can see this slide, it's maybe a little bit difficult to look at, but the dark purple is where countries need to accelerate towards their own national target. And what I'm trying to get at here is there's an accountability factor that is very important. So I guess countries are not accountable to a global target of 100%. They're accountable to what they decided themselves. And so this essentially calls these countries to account. So using their own definitions, and even their own using their own definitions, and looking at the JMP data, we can take a look and see how they're off track or on track. And this kind of was the one figure that made the headlines when we launched this GLASS report, and that was in just before 2023. But 45% of countries, so less than half of countries, are on track to achieve their own specified national drinking water coverage targets. And only a quarter of countries are on track to achieve their national sanitation targets. And then just diving into depth here, I love this slide, and you'll probably just not understand or see it properly because it's complicated. So why should I love it anyway? But what it's basically trying to do is it's trying to really take a look at a starting point, which is the purple, the latest coverage reported by a country, and then trying to see where its national coverage target is and making a line between the two. So the purple is joined to a yellow. And if we take, oh God. Yeah, if we take, say, the Philippines at 5.8, I don't know if you can see that. So I'm probably diving way too far into details now, and people with small screens can't see this. But you'll see that the 5.8 represents the annual rate of change that will be needed to meet their own national coverage target. And so these are very steep lines. And the message I'm trying to get across here is that when we do this analysis, this accountability exercise, if you will, and we look at the trend of progress that has been determined by JMP, we're finding that it's really, really, really countries are far off from what they need to get to. So it's a different, slightly different way of, when I talked about these acceleration scenarios before with only the JMP data, this is slightly different, but it's interesting. You probably, with this slide and all the detail, might be difficult to pick up, but it might be worth revisiting the GLASS report if you're interested to look at the methodology for this. Now, when we talk about big kind of issues and big bouchons in French, the big bottlenecks, human resources is almost always, along with financing, the top of the list. And you can see here that the first thing that's striking, if we look at human resources for, say, operations and maintenance, all the way through to regulation, monitoring, sanitation is reported as really lagging behind. So that's the kind of the green data on the right-hand side. And so, we're looking at about 30% of countries are indicating they're almost there with their human resources for sanitation, and then probably close to 45% for drinking water. But it's countries are sort of indicating that their human resource constraints are immense, actually. And so that's the striking thing, when you think about it in terms of the quantity. And it's not even to get to 100% of what they need, it's to get to 75%. Okay, so my next slide, this is a little simpler to absorb, this one, but again, countries reporting massive financial gaps here, which isn't surprising. And we'll speak more about how to increase funding in a moment. But what we have done with the GLASS report is we have a methodology called TrackFin and an accounting system that is inspired from the National System of Health Accounts. And it is really trying to understand through household expenditure surveys, through utility data, through government budgets and everything else, where expenditure comes from. So who's actually paying, what is the source of the funding, who's paying? And you'll see the households themselves, and maybe a lot of you, this is not a surprise either, but it does sort of hurt my head a bit when people talk about, and even I did it myself, talk about ODA going down, which is the pink, the external sources. And we think, oh, well, everything's going to kind of grind to a halt. Well, it only represents 3% of the funding. So it's really this public expenditure, this yellow, at about 30%, that is tremendously important, and we believe can catalyze what household decisions about how they want to spend their money. If the government does it in a strategic way, then that's super helpful. So those two big chunks there represent the vast majority of WASH expenditure and need to be influenced. I'm almost done with the GLASS, but let me just say that this is a typical slide, but if we look at policies and plans, specific measures to extend drinking water and sanitation to people living in poverty, it's I'd say like the vast majority of countries have policies and plans in place. say about a little more than half monitor whether services are getting to populations that are living in poverty. And then about maybe 1/3 of countries are actually have specific measures to actually direct the resources and applying them. So again, it's there's a lot of words, but when it comes to like actually getting the funding across, it's quite a different story. Now, two last slides on regulation, and this is where we feel I talked at the beginning about strategic opportunities, and we feel like this is tremendously important for improving service quality and professionalizing services. And again, just looking at this is a percentage of countries implementing regulatory functions on urban sanitation, which is dear to many people's hearts. And only 6% of countries are actually feeling like they collect and publish publicly accessible data on septic tank and pit latrine emptying and service quality. So that's the half the world is using on-site or non-sewered sanitation. So that's somewhat of a dismal figure and one that we can improve on. And then a similar, maybe not as bad, but a similar figure for regulating drinking water. And again, it's this whole thing around like we as WHO, we care about health. And so drinking water service quality is often, you look at these regulatory reports and you'll see certain metrics and benchmarks being kind of consistently published, but if you're actually getting meaningful reports on the quality of the drinking water services, or even things like E. coli in drinking water, you're not seeing many countries publish that, and this is like 10%. Clarissa will like this one, because we had a nice discussion a couple of weeks ago in the strategic advisory group for JMP and glass, and we had a wide-ranging discussion on trying to improve our monitoring of gender. And one thing that I took away, and may not necessarily be representative of the group's feelings, but this issue around women's participation in decision making and management could be one of the most important pieces that we have. And we should monitor and improve that. And here you see the bottom slide is saying that there's less than 1/3 of women having this sort of meaningful role in this case, rural water management. So I wanted to also just draw your attention to the fact that for all the researchers out there, you can go and have fun on a new glass data portal. I don't know how many of you have visited it and discovered it, but it's there, and you could I presented probably I don't know, about 3% of the glass data. So there's another 97% out for grabs, which a lot of it hasn't been actually presented or analyzed in reports. So that's a trend now, or sorry, that's something to go to. We tried to do like a mini research kind of initiative with the glass, and it's always been difficult to try to find trends between those countries that are meeting their targets and progressing, and actually areas of the enabling environment. It's incredibly difficult to find these patterns and associations, but you can see there's 4 issues that we've looked at, and some of them are kind of no-brainers: human financial resources, and terrace covering, and O&M, and utilization of funds. But the effective regulatory authorities, to me, is and I think to us is very interesting, and we want to dive into that because, again, as I said before, that's important to understand. And linked to this, and I'll come to it at the very end of my presentation, but we have talked about, or we talk about as a UN system, a number of acceleration kind of criteria, like where we think about areas that require acceleration. And you can see that these are broadly governance, financing, capacity, data information, and innovation. And then when it comes to regulation, regulation can benefit in each of these ways. I was recently at a meeting in Kigali with our international network of wash regulators. And we produced a statement which hopefully will be promoted to the world around the need for better regulation and having, we call it the Kigali Statement, but having a better enabling environment for regulators to work in and under so they can do their job. And, and so they have the mandate to regulate, for example, all steps of the sanitation chain or rural drinking water, where sometimes there's no mandate at all. And using a risk-based approach. So this governance is very important. I mentioned the investment piece earlier about trying to get, the strategic investments so that households themselves are, feel like it's worthwhile to pay for these services. I mentioned quite a bit already about capacity development, but the effectiveness of the regulators themselves is something that would benefit from increased peer-to-peer sharing of experiences, and that's what we're doing through RegNet. And there's a lot of regional regulatory associations that are trying to SOAS, Eastern and Southern African regulatory associations, doing a tremendous amount of work to share experiences to try to get autonomous or independent regulation into place. And then, of course, there's all the pieces around data information, robust regulatory monitoring systems, and actually using that information so that there is corrective action. Now, I see I'm at 35, and I was told to do 30 minutes to 40 minutes. So I'm going to accelerate a little bit here, and I hope not to lose anyone. But just mentioning that we have a RegNet network, and what we're trying to do is work with and even help establish some of these regional regulatory associations. So there's some great ones. There's a great one in Latin America and Africa, but there has been interest in starting one in Arab countries and in Asia, and in actually in Francophone Africa as well. So, with hopefully by getting some political oomph behind regulation in coordination with some of our international partners, we can, with the bank and UNICEF and others, we can, and by the way, everyone is trying to promote regulation as well. So hopefully we can get this going. Wow. So, and this is just sort of diving in. I think I was getting excited putting this presentation together because now I'm realizing, God, there's a lot in here. But the issue around like what actually does it take to have like good regulation in place. We're beginning to work on advancing a sanitation roadmap for regulation, and it's still in a draft format, but and this is with thanks to Sam Drabble and others, the sanitation team at WHO, and working on this, but just this notion of trying to systematically go from looking at, hey, like, do we have mandates to do service regulation? How's the health of our institutions and the coordination? Are there regulations in place, tariffs, licensing, enforcement, key metrics, monitoring, and human resources? So all these things, need to be worked on for effective regulation, and we're hoping to promote this. Okay. So now we're getting to the WHO bit, which is, I don't know how much of you guys think about what you think about WHO, but you can read our strategy. We do like, I talked a lot about monitoring. So we do a lot of monitoring, and I haven't spoken as much about guidelines, but we spend a lot of time doing evidence-based guidelines, trying to look at all the research and trying to kind of, with expert judgment, kind of provide authoritative recommendations to countries. And those are our two main pieces of work. But of course, we work with stakeholders and do a direct technical assistance to countries as well. And there's a big piece on emergencies, which I won't go into right now. Look, I could go into all the work on drinking water safety, but this is our longest standing area of work. It's very, I would say, mature. It's probably the what we're most known for. We've been working for the last, let me see, 20-ish years on promoting risk-based management through water safety plans and making sure our guidelines for drinking water quality, are up to date. It's something like 100 plus contaminants. And just a wealth of information in there. And what we're most excited about now, and I saw Angela on the call, who is Angela Reinhold, who's just been incredible to work with, and we're launching next week. I think it's possibly next Thursday. New guidelines for drinking water quality, and this is for small systems. So it's really, this one is really practically oriented, and you can see just probably from the cover that there's a lot of illustrations, hopefully very user friendly, and bringing together like 60 years of experience around guidelines, and it's covering some of the usual issues that WHO would cover in guidelines. But I think what's interesting is all this stuff I was talking about around glass, like the enabling environment. Does an enabling environment work? Is in place to actually do small system, good practice? That is a new thing that we're actually added to it. And so here's just a little bit of a taster of what you'll see as far as the sanitary inspection forms and how they differ from the 1997 guidelines, which is 25 plus years ago. So we've taken some time to revise it, but hopefully there's some really interesting tools in there. And you could see that we have a whole companion volume that's looking at sanitary inspections. And these are the various types of technologies that we're zooming in on. And hopefully, small systems is developed and developing country, kind of relevant, right? So hopefully for the Canadian audience, this is something really useful. And we've directed this document to be, it's not just, the rural, village water supply, in rural Africa. It is definitely meant to be global. Okay, so we also have a whole team on sanitation. There's some really, kind of promoting the guidelines. We have a kind of similar guidelines in sanitation. There's a lot of really interesting things around wastewater monitoring that's happening now, and antimicrobial resistance. And maybe I'll just say that the main thrust of our work now is working together with UNICEF to promote a big shift now from CLTS type approaches to safely managed with their sanitation game plan and our guidelines. So we're looking forward to working with a variety of partners to kind of change that paradigm so that we have, as you can see on the bottom of your slide, a really nice, kind of protection and regulation and, at every point of the sanitation chain. So we're not getting exposures to fecal oral, for example, kind of disease transmission. Wash in healthcare facilities. I could not talk about this. This is another joint program with UNICEF, but there's just recently been a UN General Assembly resolution on this, which is exciting, and hopefully will add more, kind of political commitment to this area, which is, for all of those of you that work more on the community side, half of these healthcare facilities are missing hand hygiene, either at points of care or at toilets. So it's incredibly difficult to imagine that we're so far behind on this, but we're busy tracking and working with countries to see where they're doing, how they're faring on roadmaps and financing and monitoring, et cetera, which is the publicly available progress tracker if you just Google WASH and HCF. Okay. And then coming back to a little bit of health, I mentioned cholera, I mentioned COVID-19. We've been doing joint work with the Neglected Tropical Disease Program. Most, if not all, of tropical diseases have some association with WASH, whether it's prevention or cure or care, I should say. And we have some interesting, all those global burden of disease figures. Actually, we report that officially through SDG indicator 3.1.2 under the SDG on health. Finally, and I'm coming to a close here. I can imagine I'm coming to a close. The endless PowerPoint, the WHO UNICEF Hand Hygiene Initiative partnership, I should say, which was initiated or conceived during the COVID-19 time, and we're hoping to continue that and making sure that that when we look to pandemic preparedness and in relation to the new pandemic treaty, making sure that we actually are allowing and helping governments, get the basics as far as water supply and soap, and putting a guidelines and technical assistance to make sure that hand hygiene is not the forgotten H in WASH. We have a climate change supplement to our strategy, which I think you might be interested in reading. I won't go into. And then just to conclude, what does the UN system saying finally about kind of trying to get us back on track? And I mentioned this SDG 6 acceleration framework, and these are the 5 accelerators. And you can see here we have the blueprint, the magical blueprint. So massively pouring in more funds, filling in data, investing in the workforce, boosting innovation, and maximizing cooperation. And so this is all in a nicely, a big, nice report to take a look at. And I would be remiss not to say that, and this is my final slide, that all the data on the Joint Monitoring Program on glass, together with case studies and insights from experts and good practice, is captured in these 3 state of reports, which are put out by WHO and UNICEF. And I would be remiss in saying Clarissa did not play a very leading role in this. But I think the main message from all these reports is, and it gets to my first, kind of comment and puzzle about what does all this mean. Well, I'll continue to take the optimistic path. History does show that it's possible. There are countries that have kind of promoted and advanced WASH in advance of economic development significantly. There's many things to learn, and it's sometimes it's just a matter, as we always say, of political will. So all the materials I talked about are on this link, which is very long and wordy. So you can just Google WHO WASH and you'll get to the right place. And with that, thanks for your attention. So I think I realize it was a little rush there, but I'm going to stop my share. Okay, so over to you.